Chapter 4. In this chapter, we're going to start looking at infection control, including hand washing, applying and removal of PPE, as well as the various pathogenic and non-pathogenic microorganisms we need to be aware of, as along with bloodborne pathogens. So pathogenic organisms are disease-causing microorganisms. Non-disease or non-pathogenic microorganisms are normally skin bacteria that's found on our skin that would help, and then communicable diseases, so infectious microorganisms transmitted to an individual by direct or indirect contact, or as airborne infections. So an example of this, in our large intestine, we have E. coli present. It's non-disease causing, non-pathogenic. However, if it gets out of our large intestine and gets into our urinary tract, then it becomes a pathogenic organism and it causes urinary tract infections. So that gives you an example. Our body, we have what's called like good bacteria that's normally present that would help assist the removal of skin. It helps in our digestive breakdown. So there is some bacteria that's non-disease causing. Bloodborne pathogens: hepatitis A, B, C, D, and E, HIV, syphilis, malaria, human T-cell lymphotrophic virus, Ebola virus, and Zika virus. Hepatitis A is most commonly associated with food contamination, so this would be the main cause of food poisoning. Hepatitis B is the only current hepatitis that has a vaccine against it, and this is for people who are exposed to blood or blood products on a daily basis in their job. Malaria can be contracted by mosquitoes, and as we know, Zika is another one as well that could be mosquito-borne. HAI, or healthcare-associated infection, or what's called nosocomial infection, is acquired by patients after admission to a healthcare facility. So you came in with the flu and you ended up with a staph infection. Approximately 1 of every 20 hospitalized patients will contract an HAI. Some HAIs, including UTIs, due to catheterization, may not be covered by health insurance. CDC and NIOSH provide research on types of HAIs in nationwide healthcare facilities to determine methods for decrease and avoid these infections for patients and healthcare providers. HAIs are infection control programs developed guidelines by the CDC and the Joint Commission and state regulatory agencies. So this addresses asepsis, isolation procedures, appropriate cleaning, education, management, community-acquired infection, and healthcare-associated infection. So isolation procedures would be, for example, with coronavirus, they ask that staff wear face shields, N95 masks, gown, gloves, booties to prevent the spread of the infection. Then there's antibiotic-resistant microorganisms. An example of this would be MRSA. Can cause severe problems, including bloodstream infection, severe skin infection, pneumonia, sepsis, and death. It can be colonized in the nose. There's also C. difficile, which is C. diff, which causes colitis. An antibiotic-resistant microorganism, and it's an organism that we would generally treat with penicillin, let's say. And because of changes in the microorganism, that is no longer effective. These are the most problematic because they become resistant to various antibiotics. It makes it very hard to treat. Aseptic technique. This is frequent hand hygiene, hand washing, or alcohol-based hand rubs. Use of barrier garments and personal protective equipment. Avoidance of using mobile phones in the clinical setting, and waste management contaminated materials. So for example, our sharps, our needles go in a puncture-resistant sharps container. Some of the personal protective equipment we might use is gowns, gloves, face shields, masks, and goggles. It's also use of proper cleaning solutions. So we use super sandy cloths to clean down surfaces or a bleach solution. Use of standard precautions. So we treat every patient like they have something. So we're using one-time use gloves, one-time use tourniquet, and use of sterile procedures when necessary during surgeries. Please see table 4.1 and 4.2 in your textbook to reference, but cleaning, proper cleaning solutions, this would even apply for use of cleaning solutions for the arms, so chlorhexidine and isopropyl alcohol. OSHA, is the agency of the U.S. Department of Labor, requires employers to provide measures that will protect workers exposed to biological hazards. So, for example, in our field of phlebotomy, they pay for and recommend we get the hepatitis B vaccine. They will also cover us in case of any type of needle stick injury. But they are also in regulation with making sure our equipment is safe and we dispose of it properly. Healthcare workers routinely exposed to blood and bodily fluids must take precautions of wearing gloves to protect themselves from infection, but please be aware that gloves will not prevent a needle from penetrating. They're there if you were to get blood product on you. This allows follow universal precautions for potential bloodborne pathogen exposures and warning labels on containers that contain blood. So it would look like this: biohazard. On our sharps container, it says sharps container and shows the symbol as well. Exposure control. If we were to get an accidental needle stick immediately after exposure incident, an employee must decontaminate the needle stick site with soap and water, flush exposed mucous membrane sites if exposed, report the incident right away to a supervisor and undergo medical evaluation. It is essential that this is done within 24 hours of exposure. You document what equipment or what procedure caused the needle stick, and if in the best case scenario, you know who your source patient is, we would draw the source patient and you for follow-up. If we do not know the source patient, there is still follow-up to assist with this, but being aware of the fact that if you had a needle stick, you report it right away. You don't just forget about it. I myself have had one needle stick injury in my career, and I went to put a needle in a sharps container, and my thumb slipped into the back of the tube holder. And that was the best case scenario because I knew my source patient. I knew exactly who I drew last. I cleaned the site, called my supervisor. They took me off the shift. I was off for 24 to 48 hours for follow-up, and then they do follow-up again 6 months later as well. So employee health programs' primary objective is to minimize the risk of infection or hazardous circumstances for employees and patients, screening for diseases prior to employment. So measles, mumps, tuberculosis, hepatitis, diarrheal disease, syphilis, and skin disease. They're just making sure that we have minimized risks. Works at potential exposure for having patients that could have these, so having vaccines is essential. Skin disease is more so to protect yourself if you have psoriasis or eczema. They just want to make sure those areas are closed because that's an open wound that could become contaminated. So we're going to start looking at the chain of infection. The chain of infection starts with a pathogen. So Staph aureus in this case, then a reservoir. This would be whoever is hosting the infection, so the infected patient. Then we get the portal of exit. The portal of exit is how the bacteria or virus gets out of the patient, so respiratory droplets. Mode of transmission is how does it get from outside of the body to, let's say, the healthcare worker's hands. And then from the mode of transmission, we're looking at portal of entry. How does it get into the next patient? It could be an open wound or nasal cavity. And then our susceptible host or hospitalized patient. We're going to cover this more in detail, not only in our lab, but I'm also going to cover a case study inside your discussion. So chain of infection, I will post this video along with this PowerPoint so you can see. In this video, it just highlights, so this person has an infection and without proper hand washing, how it easily transfers. So hand washing procedures for sterile technique, proper waste disposal, appropriate laundry service, and housekeeping are ways of controlling the sources. Isolation techniques, control of insects and rodents, and use of disposable equipment and supplies help interrupt the modes of transmission. Prior to, I'd say 2001, tourniquets used to be a single, we would use the same tourniquet and the patient wipe it down with a bleach solution or alcohol and you keep using it. That had been shown to transfer diseases from one patient to the other. So now we went disposable single-use tourniquet for all our patients. Okay, so the host susceptibility is controlled by speed of patient's recovery, immunization and transfusion, proper nutrition, medication, and adequate exercise help maintain and regain health. Okay, in your book, it breaks down the chain of infection. I really want you to look this over in detail, knowing the different steps. So knowing that you need a pathogen, you need a reservoir, you need a portal of exit, mode of transmission, then you need a portal of entry, and then a susceptible host. Go over in detail each step because you will be tested on that later in this chapter. Standard precautions, they're designed to reduce the risk of transmission of microorganisms from both recognized and unrecognized sources of infection in the hospitals. Standard precautions provide protection from contact with blood, all bodily fluids, mucous membranes, and non-attacked skin, where universal precautions are designed to prevent transmission of all infectious agents. So the difference between the two, standard is designed to reduce the risk, where universal is designed to prevent the transmission of all infectious agents. They overlap each other. So this is use of, personal protective equipment, proper cleaning, proper, use of disposal of our items as well. So in the hospital setting, there is what's called the HICPAC precautions. These are transmission-based precautions. So we might see a sign outside the patient door that looks like this. This is an airborne precaution. It's reduce the spread of airborne droplet transmission. Airborne, the particles are about 5 microns or less. A disease example of this would be measles, varicella, and TB. And we'll cover what PPE is required. In your book, there is a chart that I really want you to reference. The PPE required for airborne would be an N95 mask, gloves, and you could choose to wear a gown. The patient would also be placed in what's called a negative pressure room. This would be because of these diseases being small and can travel. We don't want it to get into the ventilation system. Droplet precautions. This is to reduce the disease transmission from contact of mucous membranes, eye, mouth, nose. Large particle droplets that occur through sneezing, coughing, and talking. So droplet precautions, droplets are big particles, so they're 5 microns or more. Pertussis, rubella, and pneumonia are some examples of droplet. Influenza, the flu, would also be a droplet precaution. What is needed for this precaution for PPE is a mask and gloves at the minimum. Can we always wear more PPE? Yes. Personal protective equipment, for sure. But for droplet, we need a surgical mask and gloves at the minimum when entering these patients' rooms. Our third transmission-based precaution would be contact precaution. This is to reduce the risk of transmission of disease through direct and indirect contact. Examples of this would be scabies and hepatitis A. Table 4/3 in your textbook, I definitely want you to reference. This will come up again, knowing what the isolation precaution is. So is it contact or airborne or droplet? What's the purpose? So the purpose would be as represented in the first arrow here. give an example of a disease, and then what PPE. So PPE for contact would be gown and gloves. We want to prevent it contacting our front, and with all these precautions, we want to be mindful of hand hygiene as well. You can always wear more PPE, but contact, we're looking at making sure that nothing gets in contact with like our scrubs, our hands. So every precaution we need to be aware of also includes appropriate hand hygiene. There is a fourth transmission-based precaution, which we will cover later on in this chapter. Use of standard precautions. Use of standard precautions, personal protective equipment to prevent exposure when contact with blood and other bodily fluids of a patient is anticipated. Hands and other skin surfaces washed immediately and thoroughly if contaminated, and hands washed immediately after gloves are removed. This is a figure. It goes over hand washing with the use of an alcohol-based hand sanitizer. I will post this video in this chapter folder. Again, standard precautions, taking precautions to prevent injuries caused by needles and other sharps instruments. So we know during the blood collection procedure, during disposal, and when handling sharps instruments after the procedure, where's our sharps container? Making sure it's not full. Making sure we have all our equipment nearby, so we're not having to reach and grab things. Also being aware of our patient disposition, because if they're going to be combative or they're not going to be able to help cooperate, we get help. Okay, prevent infection from bloodborne pathogens, so use of safely engineered needles and sharp devices. We will never recap a needle, purposely bend or break them by hand, remove them from a disposable syringe or from the tube holder, and handle them for any reason. When we dispose of our needle, it is one unit. All components disposed of is one unit. If you realize your sharps container is overfilled, don't try to shove it into the sharps container. Don't put it in a biohazard bag. We want it in a puncture-resistant container. So we're going to immediately dispose of the blood tube holder, as safety needle is a single unit as represented here. You're going to place the disposable needle, lancet, and other sharps items after use in the puncture-resistant container. This ideally should be done right away. So as soon as it comes out of your patient, you're disposing of it. We'll never set it down on a table surface after we draw. So what we do is we ask the patient to hold the gauze, and then we will go ahead and dispose of our needle before we continue with the end of our procedure. So standard precautions include: do not wear artificial nails or extenders, keep fingernails less than 1/4 long, and wear gloves when possible. Contact with blood and other infectious materials. Remove gloves after you're completely done with collection labeling. So we remove our gloves once the tubes are labeled and they're in our biohazard bag. Please keep in mind with the artificial nails, they don't want any acrylics. You can have your natural nails colored, but again, you got to keep in mind of length is really essential, because you can harbor bacteria underneath your nails, and also minimize jewelry. To control the outbreak, and infection control staff may detect the need for special precautions, isolation procedures, or employee screening for staphylococcal carriers. With increased possibility of respiratory infections, the CDC is requesting healthcare workers to instruct patients and company individuals who have signs of respiratory infection to cover their mouth, nose when coughing or sneezing. They might ask them to wear a face mask and perform hand hygiene. So our fourth isolation precaution is called reverse isolation, or protective environment isolation. This is for patients who are recovering from cancer treatment or immunocompromised. All food and articles sterilized before they are taken into the patient's room. We are basically protecting the patient from us. We are the risk to the patient, because without an immune system, and this would apply to NICU babies as well, they are easily a susceptible host. Okay, infection control in the nursery unit. Newborns are easy targets for infection of all sorts because their immune system is not fully developed at birth. Neonates may pick up a pathogen from their mothers and other babies or hospital personnel, so infection control procedures of hand hygiene, gown, glove, masking prior to entering the nursery and NICU is essential. Reverse isolation is also used for burn patients. Patients who are highly susceptible to infection would be burn patients because they're missing that first layer of defense, which is our skin. Patients in intensive care units, post-operative care units, patients needing dialysis, and cancer patients. These are some of the key examples of what would be considered a susceptible host. Also, a susceptible host could be someone who's on antibiotics. So infection control for compromised patients. So each patient's bed is surrounded by a plastic curtain with sleeves. Hospital personnel use those sleeves to have contact with the patient. And all supplies and equipment are kept outside of the curtain. Keep in mind that when we draw burn patients, we may not actively be drawing them depending upon the degree and where the burns are at. They might have a special line put in to collect blood. Because of the lack of having that layer of protection, we could introduce an infection unknowingly. So infection control in special hospital units. With compromised patients, they have a strict gown, glove, double bagging, strict hand washing procedures used. All articles in the room as well as the room itself should be disinfected or sterilized frequently. So basically we go in with the equipment we're going to use, we dispose of it. The only thing we'll walk out with is the tube from our patient and the biohazard bag. So PPE isolation, so we could use a disposable gown, gloves, mask, protective eyewear. We could use a face shield. In some cases, they might ask you to wear protective booties as well over your shoes. And this is just what this is a mask that has a built-in face shield. If we think we're going to come into any fluid contact that could get into our eyes. Okay, I will share this video removal of isolation gloves, goggles, face shield, gown, and mask. Please be aware that their CDC has 2 different procedures for disposing of PPE, which I will provide this picture in a bigger format. So the first way by book standards is you're going to down your PPE, and we'll have a lab covering this, but when you go to remove it, they ask that you remove, it goes gloves, gown, and the mask would be last. There's also the tearaway method, which we will show you as well in the classroom setting, but I will have this bigger image for you to be able to visualize and see. So removal of patient specimens from an isolation room, we're going to follow required procedure for entering the isolation room. There will be a cart on the outside of the patient's room that says what PPE you need to wear. We're going to label the blood tubes with the correct IDs. It has to be by the patient's bedside. We're going to collect the blood and place the tubes in a clean plastic biohazard bag outside of the room, and complete hand hygiene. Transport the blood specimen to the laboratory within the appropriate laboratory request form. And also keep in mind that we need to perform our hand hygiene. If collecting blood specimen, use of a tourniquet in the room or use the one brought in. Label the specimen at the bedside and leave the pen in the room. Remove any blood on the outside of the specimen container with a paper towel and discard needles appropriately. Figure 4/3-8 in your book talks about disposing of contaminated items. So please review this as well as the procedure. You will be covering this in lab. This would be in a circumstance where you're in an isolation room, but they do not have a disposal, so you can dispose of your items. So we would use a dirty and clean person to dispose of any contaminated items, as well as our PPE, if that were not an option. We use walkie-talkies, so it's a little button that could be attached to our scrub top to where we could call for help. Most rooms now have a big, looks like a garbage pail, but it has a red biohazard bag. Lets us know this is where we can dump our PPE gear and anything that came in contact with blood. Clinical laboratory contributes to infection control programs by maintaining lab records for surveillance purposes and reporting in infectious agents, drug-resistant microorganisms, and outbreaks. Clinical laboratory contributes to infection control programs by evaluating effectiveness of sterilization or decontamination procedures and follows essentials of standard precautions and safe laboratory work practices. So we're going to cover disinfectants and antiseptics. A disinfectant is a chemical compound used to remove or kill a pathogenic microorganism, generally used on the surface and instruments because they are too corrosive for direct use of this on the skin. So an example of this would be bleach. Your book also covers in a chart other disinfectants, so please review that. Where an antiseptic is chemical used to inhibit the growth and development of microorganisms, but does not necessarily kill them. May be used on the human skin. So an example of this would be a hand sanitizer. Gloves and gowns worn when performing decontamination procedures. Table 4.4, 4.5, and 4.6 in your textbook are great reference resources for this. Another antiseptic would be isopropyl alcohol or chlorhexidine. They inhibit the growth, but they don't kill it. So keep that in mind when we're looking at the difference between an antiseptic and a disinfectant. In summary, please review the chain of infection with all the steps, knowing an example of each. Review your HICPIC transmission-based precautions, so knowing airborne precaution, contact precaution, and droplet precaution. And then also reviewing the type of PPE we use is really essential in this chapter, and any procedures covered within the lecture chapter as well. So hand hygiene, downing and removing of your PPE gear, disposing of contaminated items, as those will be presented in the lab, but knowing what the procedures require is essential to prepare. Again, make sure to read this chapter. This chapter will be presented with chapter 5 in your test, so it'll be a combination of both. Completing the discussion as well as the questions at the end of the chapter to help you prepare for the lecture test at the end of this week. This concludes chapter 4, PowerPoint.